Mr. Speaker, transgender and gender variant Albertans face a variety of barriers on a daily basis, not the least of which is adequate supportive access to healthcare services. As someone who is very involved in the fight for LGBTQ+ equality, I hear from people from across Alberta concerned about this issue on a daily basis. To the Minister of Health, what measures does the ministry have in place to assist transgender and gender variant individuals seeking full access to healthcare?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And to the member for the question, our government is very proud of the commitments that we've made to publicly support the trans and gender variant community in Alberta. Of course, part of that is by continuing to have budget allocations for gender reassignment surgery from Alberta Health. That's included in this year's budget. As well, Mr. Speaker, we are proud of the fact that we brought Bill 7 forward as a government caucus, which passed first reading unanimously in this House last week, and we're working to enshrine gender identity and gender expression as protected categories in the Alberta Bill of Human Rights, Mr. Speaker.
First supplementary.
Thank you, Mr. Speaker. Given that supportive medical personnel and care can be vital for the well-being of transgender and gender variant individuals, and given that transgender and gender variant people are at a higher risk of heart disease, anxiety, depression, suicide, substance abuse, eating disorders, interpersonal violence, and certain cancers, because physicians and mental health practitioners often turn away transgender and gender variant people because of prejudice or perceived lack of skills to treat such patients, how can Alberta Health ensure that these individuals will be able to access appropriate resources?
Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the question. Our government, of course, believes in universal accessible health care, meaning that we have that top-quality health care for all Albertans, not just those who can afford to pay for it, Mr. Speaker. We are working to identify good models of practice for gender care. In Alberta, there's a gender clinic at the Grey Nuns Hospital that's been operational since 1996, something we should all be very proud of. As well, in the Calgary zone, there's currently a pilot project at the Meta Clinic that's been operating for about a year, at the Alberta Children's Hospital, which was formed by the partnership by the Endocrinology, Addiction and Mental Health, and Sexual and Reproductive Health, and with demonstrated positive outcomes and a good set of evidence-based practices for care, the Meta Clinic pilot.
Thank you, Madam Minister.
Mr. Speaker, given that many transgender and gender variant Albertans are worried about beginning and maintaining hormone regimens, to the same minister, are there any plans to help make hormones more accessible?
Minister of Health.
Thank you very much, Mr. Speaker. Right now, physicians in Alberta can prescribe hormone therapy to assist with transition if a doctor and patient together decide that it's the best course of action. At times, Albertans are also referred to an endocrinologist to ensure that appropriate hormones are prescribed. I'd encourage all Albertans and their family physicians to contact the College of Physicians and Surgeons to identify the appropriate physician specialist to assist with ongoing care of individuals who receive hormone therapy, Mr. Speaker. Thank you.